Hi, this is Arensman, and this is my bone video. This is a left clavicle. This end articulates with the sternum, and this end articulates with the acromion. Here we have a right scapula. Scapulas have 4 fossas. On the anterior side, we have the subscapular fossa, glenoid fossa, or glenoid cavity, the infraspinous fossa on the posterior side, and the supraspinous fossa up here. This is the spine. Here we have the acromion, or you could say acromion process. This is the coracoid process. This notch here is the suprascapular notch. Here is the superior border. This is the superior angle. This area is the medial border, and this part down here is the inferior angle. Here is the lateral border. And here we have the left humerus. On the proximal end, we have the head, the anatomical neck, which goes all the way around, the surgical neck, which goes around here, the greater tubercle, this big knob, the lesser tubercle, the bicipital groove, and then down here we have the deltoid tuberosity. On the posterior view of the distal end, we have the olecranon fossa. We have the trochlea, which starts here and goes all the way around here. This little bit is the capitulum. Here we have the carotenoid fossa, the radial fossa, the medial epicondyle, this bit, and the lateral epicondyle. Next we have the right radius. Starting at the proximal end, we have the head, which is this circular knob, and just below it is the neck. This bump here is the radial tuberosity, and down here we have the styloid process. Next we have a left ulna. On the proximal end, we have the olecranon, big part. We have the trochlear notch, the coronoid process, the radial notch. On the distal end, we have the head and the styloid process. Here we have a right hand. Hands have 8 carpals. We have the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Here we have a loose hamate. It's this one that sticks up. A loose pisiform, this little one over here. And a loose scaphoid, which is this one right here. Next are the metacarpals. They're numbered lateral to medial. We have 1, 2, 3, 4, 5 metacarpals. Each metacarpal has a base, this knobby part here, and a head, this knobby part on this side. Then we have the phalanges. We have proximal phalange, starting also lateral to medial, 1, 2, 3, 4, 5 proximal phalanges. The pollex does not have a middle phalange, so we start on 2, 3, 4, 5 middle phalanges. And then we have the distal phalange, starting on the pollex, 1, 2, 3, 4, 5. Next, we have a left pelvic bone. There are 3 parts to the pelvis: the ilium, the ischium, this part right here, and the pubis. There are 5 spines on a pelvis: the ischial spine, the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. This is the iliac fossa. This top part is the iliac crest. Down here we have the greater sciatic notch and the lesser sciatic notch. This is the ischial tuberosity, and this rough spot is the pubis symphysis. There are 3 rami: the superior ramus going around, the inferior ramus on this side going around, and the ischial ramus going around. This large hole is the obturator foramen, and on this side is the acetabulum. And that is your pelvis. Next, we have a left femur. On the proximal side, we have the head, which is this ball-shaped part. The neck, it's the constriction. The greater trochanter, this big knob, and the lesser trochanter, which is a small knob. This is the intertrochanteric crest. And back here, we have the intertrochanteric line. On this side, this little rough area, is the gluteal tuberosity. And down here is the linea aspera. And on the distal end, we have the medial condyle that wraps around all the way over here. We have the lateral condyle. It's this smooth surface that wraps around here. Between these two, we have the intercondylar notch. And then over here, this rough protrusion is the medial epicondyle. And this rough protrusion on this side is the lateral epicondyle. And the smooth spot between the condyles is the patellar surface. Now we have a smaller bone here, the patella, and you can tell whether it's right or left by the way it falls. This one falls to the right, so there's a right patella. On the distal end is the apex, it's the pointy end, and on the proximal end is the base. Here we have a right tibia. On the proximal side, we have a medial condyle, the smooth spot, and a lateral condyle. Between them is the intercondylar eminence, and this rough bump is the tibial tuberosity. This is the anterior crest, and this knob sticks out here is the medial malleolus. Next, we have the fibula. On the proximal end, this flaring out part is the head. Down below it is the neck, goes all the way around. The long part is the shaft. And down here, this part that sticks out and points a little bit is the lateral malleolus. Lastly, we have a right foot. The heel is made of the calcaneus, which is also shown here, loose. This smooth surface and this whole bone is the talus. The smooth surface articulates with tibia. Here we have a loose, you can see the smooth surface of the talus. The smaller bone between is the navicular, and we have a loose navicular here. These three are cuneiform, and this is the cuboid. Next we have the metatarsals. They're numbered 1 through 5, medial to lateral. We have 1, 2, 3, 4, 5. They have their base is down here on each one, and then the head is up here on each one, the knobby parts. Then we have the phalanges, and they're also numbered 1 through 5, medial to lateral. We have the proximal phalange, 1, 2, 3, 4, 5. The hallux does not have a middle phalange, so we start here on 2, 3, 4, 5, middle phalange. Then we have the distal phalanges. We have 1, 2, 3, 4, 5. And then we have the 3 arches. This is the lateral longitudinal arch, the transverse arch, and the medial longitudinal arch.